We've all seen this scene. A man freezes, grabs his chest and collapses. It's quite shocking, and it's unmistakably we know that it is a cardiac sounding chest pain. Do women get the same heart symptoms? Let us talk women and heart today. I'm Dr. Shiva here. Instead of crushing chest pain, women often feel unshakable fatigue, nausea that feels like a stomach bug, jaw pain, back or a shoulder blade ache, breathlessness climbing stairs, or just a sense of something that is wrong. These all seem vague symptoms, isn't it? But these symptoms have been labeled as atypical. But atypical for whom? For women, these often are the typical signs. Why we feel these are atypical is because traditionally it has been the male symptoms that have been studied, but women present differently. There's a myth that if your angiogram is normal, your heart is fine. But the truth is, women are more likely to have normal angiogram because they have microvascular disease, that is problems in the tiny vessels that don't show up on standard test. So the angiogram can look normal, you must have been said you are fine, but your heart is still struggling. And too many women are told maybe it's stress, when actually in reality, the problem is simply invisible to the wrong test. The heart disease is a leading cause of death in women. Yes. Not breast cancer, not stroke, but heart disease is the primary killer for women. That's because women often get diagnosed later, treated later, and they are believed later. Menopausal and perimenopausal women are at higher risk of conditions SCAD, which is spontaneous coronary artery dissection, and MINOCA. The MINOCA is nothing but myocardial infarction with non-obstructive coronary arteries. It's a type of heart attack which predominantly affects the women, particularly during and after the transition to menopause. So listen to your body whenever you have some vague symptoms. Trust what your symptoms are telling you and insist they are taken seriously by your family members and at the hospital. Menopause is a cardiovascular clock change. The estrogen decline causes the vascular changes. It's a cardiovascular turning point because the estrogen drops, blood pressure raises, cholesterol increases, insulin resistance increases, and so the heart disease risk climbs. That's why early lifestyle changes and regular screening for the cardiovascular disease is very, very essential for women. Is HRT too dangerous for the heart? This needs a little bit of nuance. For healthy women under the age of 60 and within 10 years of menopause, evidence shows that HRT has a favorable risk-benefit profile. Newer thinking suggests that even women with a history of heart disease, previously if they had a heart attack, they should not be said an automatic no for HRT. There are transdermal versions like gel, spray, and the patches which are available, but the decision has to be personalized and prescribed by your own physician or gynecologist. So next, let us move on to what can we do to reduce that heart risk, cardiovascular risk after menopause. Women need to aim for 150 minutes of moderate exercise each week, not the mild, but the moderate. You can spread it out over 5 or 6 days, which is still totally doable. And follow a Mediterranean style diet in any cuisine. Plenty of legumes, fiber, fatty fish, protein. You can change your own diet to this. You have to focus mainly on the balance rather than restriction. Don't fall for food fads or excessive supplements. Limit the alcohol or any tobacco chewing, smoking if you have that lifestyle. Make sure that you have friends who have a nice lifestyle so that you can match with the lifestyle and have a healthy, say like a walking friend, exercise friend. The next important thing is make sure that you have a regular blood pressure check, blood check for cholesterol and the diabetes. Visit your physician and have regular checks. That is very, very crucial after the stage of perimenopause and menopause because there are a lot of things. And I said menopause is not just period stopping, but it is a cardiovascular clock change in a woman's life. Let us meet in another video. Bye.